even if you want to do surgeries on this kid, do not do surgeries on him until we fix this here first. Can you just kind of briefly talk about your son's walking problem so that we can actually see exactly what's going on?
Then I noticed that one of his other legs was going outwardly. His right is going outward, and he kind of drags the leg. He doesn't walk straight. So yeah.
So you also mentioned that you went to orthopedic doctor, right?
Mm-hmm.
So orthopedic doctor did what for you? Or for your son?
Just referred for PT,
okay.
And said by September she would like for him to go see a surgeon.
Okay.
To get an opinion, but she's looking at seeing that he might need surgery.
Okay. You said that the physical therapy has not been helping. Can you tell me exactly what physical therapy has done for him and exactly what type of the things was not helping for him?
They just gave us a couple of exercises to do at home.
Which body parts?
Lower
like
body
knees
parts.
Or hips or foot?
Foot, the whole leg. You know, they gave us resistant bands.
Gotcha.
And said he needed to walk on his strength.
Okay. So pretty much from everything that you have said, everybody has been focusing on his foot,
mm-hmm.
his ankle.
Yes.
Pretty much everybody has been focused on. Nobody was really focusing on his knees. Nobody was really looking at the lower backs or hips and nothing like this.
No.
I'm the first person who actually taking a look at his lower backs and things like this. Am I
mm-hmm.
correct? It's straight. Mm-hmm. People think that okay, that's straight, so that's not a problem. A lot of people will say that and just end up over here. But one thing that I do have to let you know, and I want to be able to kind of turn this to this side. You notice that, have you ever noticed that your son has his butt sticking out all the time? Mm-hmm. His lower back is really a lot of curvatures
like
over here. It's not really scoliosis, mm-hmm. because scoliosis means that when he has his back here like this, he has a lot of curvature here like this.
Mm-hmm.
I'll be able to show you his back is straight. But if I were to turn to sideways, look how much of curvature there is, his butt is sticking out. Mm-hmm. That's actually one of the reasons why he is actually unable to walk straight. And I'll be able to tell you the reason why. Mm-hmm. A lot of times when people come to see me as a foot doctor, they always tell me, Dr. Lee, can you come in? Please take a look at my son and my daughter's flat foot, in toe walking, out toe. They always focus on the foot. But people forget to realize you're actually walking with your hips and your lower back more than you walk with your foot. And that's what I have told you last time too, and that's exactly what I'm going to focus on here also. If you look at over here, he actually has quite interesting thing. So, for instance, can I use you as an example so that I can explain it to your wife? Stand up for me, please. Go ahead and lift up this left leg. Stable. Put it down. Put this, raise this up. Stable. A little bit unstable. Everybody has a little problem. Put it down. You see how is it stable, right? Okay, sit down for me, please. Now, let's try with you. Go ahead and lift up this leg. Did you see that? Go ahead and lift up this leg. He cannot do it. Do it again. Do it again. Do it again. Do it again, the right side. Notice, yes, right leg. Notice how he has to go all the way up to the left side first before he even do it. Last time when we did it, I think that it was you who told me, hey, don't joke around with the doctor. It's not joking around. He doesn't have any instability. That's the reason why he's actually walking out toe. The reason why is because here is actually problematic. In order for him to be able to use his hip strength and then the lower back strength, he has to use a lot of other body parts. For instance, if I actually go ahead and feel around his the thighs areas, it's very tense. You might be asking, okay, so physical therapist said that I have to strengthen these areas. That's true, but it's so tense, but they didn't tell you why it's so tense. Have you ever wondered about that? He is using this part of the leg so that he can walk. That actually makes his foot to be more out toe. Have you ever thought about that? So, his problem, all in all, and I'll be able to tell you, and I'll do a couple more tests on him so that you will be able to find out. He actually has out toe for several reasons. Number one, instability, clear instability seen in his foot. Clear instability in his lower back and in his hip. And then that actually was, I was able to demonstrate it with you raising up your left leg and right leg, and him raising a left and right leg. We were able to see both of them very, very clearly, yes? Another thing that actually is going on is his hip. No, not his hip, but his foot. His foot is very flat, and I do get that. I do understand he got a very flat foot, and I do understand that he has a collapsed arch. I do understand why surgeons don't do the surgery. Me being a foot doctor, me being a foot surgeon, I see clear indication why he needs surgery. But I see people like him all the time who have surgery and their lower back gets worse. So I want to be able to say, even if you want to do surgeries on this kid, do not do surgeries on him until we fix this here first.
Okay.
Does it make sense to you? That's one of the number one thing. I told you exactly what to do. You can do what you like to do with mother and father, but if he was my son, if he was my nephew, if he was my relative, I would not let him do surgery until I fix this. Yeah. That's exactly what I'll do. Do you understand? I'm going to go ahead and ask you to walk straight. Go all the way to the end of the hallway. Walk. You see, as he's walking, you see that his hips are moving. His lower back has absolutely no movement whatsoever. Focus not on his... Go ahead and come back. Come back. Don't focus on his foot so much, but focus on his entire body. Notice how when he's walking, his middle part of the belly, where there's his belly button, it's not moving. Every body part is looking by his belly button. It's not moving. That's where his lower back is. Turn around. And then walk again. Lower back area. You see right above where the shorts are. That's not moving. It's supposed to be moving, but it's not moving. Turn around and then come right back up. That's the reason why he's actually using side of his thighs and his hips to be able to walk. That's one of the reasons why he's walking so out toe. Does it make sense to you? Look at it. If I just look at his lower back, it's almost like this. Do you see it? It's straight, but if you look at the x-ray, it's straight. But if I look at his muscles, look at the muscles. It's almost like a sideways here like this. Do you see that? Do you see that? Another thing that you'll notice is that this part of his lower back is very, very tight.
Yes, yes.
But this part is not. Do you see the differences?
Yeah, this one.
Rock is solid.
Than this one.
So what that means to you and means to me is he actually has rotations like this.
And he's using this
like
side
this.
more than using this side.
Yes. This side is actually more locked up than this side. Do you see that? And then if you look at around this area, and he's 8 years old, look how much of a tense skin there is.
Yeah, especially here.
Do you know what this is? You see a little bubble, little circle right here? This actually is inflammations. So he has a lot of inflammation in his lower back areas. So if I press down here, no. So if I press down here, is it painful? Painful?
Is it painful? Yes. Speak.
I am pressing this much. I'm literally pressing here this much. But if I go here like this, it's a lot of pain. A lot of pain. Why? His entire lower back is inflamed. So you might be asking, okay, so his lower back is inflamed, so he has a lower back problem. No, he has a problem over here. So one of the reasons why he's unable to walk so well is because he has hip problems. There's a two problem that I actually found on him. How's the pain right here? Pain, a lot of pain, right?
A lot of pain.
Yes. I'm literally pushing down this much and he's saying a lot of pain. Why? And I'll be able to show the x-ray why that's actually painful. And based on his x-rays, I'm expecting for him to have a lot of pain right here. Your pain? He's already skirmish. He got a pain right here. The pain right here, you see? He's actually kind of being unease. So all this is external hip rotator, which means that the hip muscle is actually rotating outward. I'll be able to tell you a little bit later on too, his entire hip has rotated outside here like this. That's the reason why he's actually walking differently. So if I go ahead and then explain it to you, his entire pelvis has rotated like this. And then he actually has a lot of edemas, a lot of swellings on his hip right here. So me pushing down here like this, he feels pain. That's the reason why he's dragging. You asked me why he's dragging his leg. This is the reason why he's dragging his leg. I came here for my child's flat foot. You didn't even take a look at my child's foot. You're just doing all spine and then you're just telling me you found the problem. So what's going on? That's exactly what you're actually thinking. Number one thing that I want to let you know is walking is not done with the foot. Walking is done with hip. That's how you walk. Your movement of your walking comes from your hip and your leg. That's exactly how it comes out. Number one thing that I'll let you know is this is his butt crack. I don't know any fancy terms for that, just a butt crack. But you notice that this is how we're actually looking at him from back to front. This is how we're looking at it. You see that little holes right here? Well, those are these holes right here, these holes. So what actually has happened is his butt crack is right here, but you see, if I actually zoom in right here, like this, you see there's a butt crack, and then you see the bones are kind of crossing over here, and there's bones are kind of deviating away from it. Do you remember when I told you that your son has a rotated hip that's actually turned outward? That's exactly what I mean by this. So if this is actually butt crack, he actually has rotated hip here like this, which means that at any point there are a lot of tensions from here, from nerve from over here to this side over here like this, every single time. So what that means to you is every time he's walking, his bone actually has to work overtime on the left side to be able to do it. But you said, wait, I said to you right side he's dragging. The reason why he's dragging on the right side is because there's actually differences of the leg length with the changes with internal hip rotations. So this is foot x-rays. Remember what it looks like. It's kind of big, it's kind of thick. Look at the shape and remember the shape, okay? I'm gonna show you the left side real quick. Left side is even thicker. Do you see that? So you might be saying that, okay, so my son's left foot is thicker and my son's right foot is thinner. No, it's not even about that. So what that actually means to me is he actually has differences in his foot shapes because his leg length, limb length are looking different. Does it make sense? Did anybody mention about this? Limb length being different.
Nothing's gonna hurt. I'm going to go and grab your hip. Ow!
Okay, stand up for me. It's okay.
You don't need to see anything.
Let it down. Let it down. Don't move your knees. There you go. We got it. All right. Stand up for me, please, Lulu. Look at that. He's walking straight now. Turn around. Looking straight. Look at the out toe. Out toe is not so bad anymore. Go ahead and turn around. Turn around.
His knees trying to kiss each other.
That's because of his hip dysfunction. Turn around and come right back. He's walking straight now.
Hi, this is Dr. Lee. Before the treatment, you can clearly see the child's out toe walking, which is improved dramatically after one single treatment. There has been no surgery, no medication, no insole, just fixing the structural instability coming from his spine, namely in his hip area. You can clearly see the out toe walking before and the corrected walking pattern after. This is a total body approach to foot and ankle problem. Thank you.